Good afternoon. I'm here with Humboldt County Health Officer Dr. Teresa Frankovich for the Monday, May 4th media availability. Thank you for being here.
Hi.
Humboldt County now has a community testing site that is currently giving priority to first responders and medical staff. When do you think it will be open to the general public, and how will community members go about receiving a test?
Well, the good news is that we actually have been working with this system now over about a week. And so far, I think we've worked out a lot of the bugs, and the platform online that will allow people to register themselves for testing has gone live in order for us to be able to test it. So what we're planning is to open up access to the public beginning as early as Wednesday this week. We'll be sending out a media release shortly to explain how people should access that through the internet or by phone, and also to explain who would be appropriate for testing at this site versus another site.
Great. So far, how many COVID-19 tests have been administered at the new site at Redwood Acres? And are we seeing undetected cases of COVID-19 in the population of critical workers who've been tested, and if so, at what level?
Well, we actually have completed over 300 tests at the Redwood Acres site, not including today, because we're continuing to move forward. And actually, I am happy to report that our testing so far, the results that we have are negative, but we do not have all test results back yet because we tested throughout last week.
Okay. So you've said that a lot more testing needs to happen to allow for reopening of the county. How much in terms of the numbers of tests done or the percentage of county residents tested, how much surveillance testing needs to be done? And can you be as specific as possible about figures?
Sure. So, we set targets, and basically we set a target for testing that was based on a lower prevalence of the virus in our community because, we don't have evidence that we've got a lot of circulating virus right now. And so we set that number under 10%. And in that, we would want to test about, have the capacity to test about 200 people per day. That being said, the governor today announced that one of the criteria that we should be looking at going forward is to be able to test at least one person per 1,000 in the county on a daily basis, have that capacity as an early marker for readiness. And that would mean about 135 tests a day, which we can meet. The other piece of that is to be working towards 2 per day, which would be more like 270, and that we would have to still creep up a little bit more to meet. But I think we're at that 1 per 1,000 right now.
Excellent. So it sounds like the tests are pretty invasive. When do you expect less invasive tests to come to the county, or is that even going to be an option?
Sure. So in other venues, there is the potential to use other testing capacity. Typically, the one that is used is it's called an anterior nasal swab instead of nasopharyngeal swab. The one that's currently being done at the Optum site, and actually for a lot of patients, is the nasopharyngeal, and that is more aggressive. It involves a swab being placed up your nose fairly far back, so it's not, pleasant for sure. The other specimen that's commonly can be acquired for some tests is anterior nasal, where you actually just collect a sample from the front part of the nose. Much more comfortable and easy to do. Some tests have also used an oral swab as well. So what we're hoping is actually at our site, the Optum site, we're hoping to have the capacity to do some of the other sampling rather than just the nasopharyngeal. And so we've been in conversations with the state about that, and we'll keep people updated. So the nasopharyngeal is what most people have had who've been tested to date, and it's doable. It's just we know the other is faster and a little more pleasant, so, we'll aim for that for people.
Excellent. Is this testing site an indicator that Humboldt will meet one of the governor's 6 critical indicators, meaning we could reopen soon? And if so, how soon?
Well, I think actually, as we just mentioned, we already meet the current indicator as mentioned today, so that will be part of our plan. As the governor again noted today, for us to be able to customize and move through our stage 2, where we begin to reopen things at a speedier rate, we need to display our readiness. And so that's why we've been working like crazy on these preparedness pieces over the past weeks. And in testing, I think we really are there in terms of what the governor has requested. And again, still working on increasing that capacity even further.
Excellent. How close are we to antibody testing or testing large chunks of the population regardless of symptoms? And how would this kind of testing affect our case count in the county?
So serology is a really interesting question, and it's a bit complicated of an answer to that question. So serology measures antibodies to the virus, and the idea is that a positive test would suggest that you've been exposed to that virus and may have some immunity, right? And if the test is negative, it suggests that you have not been exposed. One important thing for people to understand right now is that even if you have a positive test that suggests that you might have had an exposure to this particular virus, if it's a well-constructed test, and we can talk about that, what we don't know yet is, does that mean that you actually are immune to the infection? And if you are immune to the infection, how long will that immunity last? So it's very difficult to make a decision about your personal health based on the serology right now, because we really can't tell you that you're protected if you're positive or for how long. So serology is great. I think it's perfect right now to be used for us to monitor our population as a whole and get an idea about how much virus might have circulated, but it is not a diagnostic tool to tell you if you have COVID, and it is not a tool right now to tell you whether you can freely move about and not worry about getting it. And until we can tell you that, it's got limited utility for the individual while being important for surveillance purposes.
What is the minimum number of daily tests you think would be sufficient solely to conduct meaningful surveillance testing, and what will the strategy be for the testing?
And I think we've answered that.
Yeah, absolutely. At this point, recognizing that testing rates have increased substantially last week, what are the most significant limiting factors in ramping up testing rates locally?
Well, again, I think we're doing really well on this. I think the thing that we will be working on going forward is further increasing our capacity. So our Optum test site can test 135 people, or 132 people actually per day, I believe, in a 12-hour day. So we will aim to keep that testing full so that we're getting a good sampling across our community. But we also have the capacity to expand that even further if we have a need for that, and that could certainly get us to the level where we could test twice what we need to meet the readiness indicators.
And you've kind of touched on this question as well, but there's a local health clinic that has recently begun offering the COVID-19 serological testing. Do you anticipate that the data from this testing will be helpful, and will it help guide local policy?
So aside from the specific clinic doing this, what I would tell you is that serology testing is becoming more widely accessible. And it's important for people to understand that because COVID is sort of, we're in an emergency sort of situation with this, some of the usual authorizations and approvals that come through have been relaxed. And so there is a vast variation in quality of the tests that are available to people. So people may have been hearing about all kinds of things, from at-home tests to finger stick tests for a specimen, which are not considered to be very useful or accurate at this time. The tests that are typically sent to a larger commercial lab, such as LabCorp or Quest, and there are some local availabilities for serology as well in, for instance, the UIHS clinic. In some of the smaller private clinics, there may be tests offered as well, but I think it's important as a consumer to think about the type of test that they're offering you if you access it. Again, the tests that are, we call in the arena ELISA tests, or sort of a higher level test typically required by a blood draw as opposed to a finger poke, will be more likely to be a reliable test for you. But you should certainly talk to your provider about it. As well, we have been we are sending out guidance for providers to walk through the different types of tests that are available right now and what's recommended. So that will be helpful to them as well. Because there's a lot of testing coming out right now, and it's confusing out there. We're referring to it as the Wild West of testing. And we want people to actually make smart choices. So we'll be providing information.
Excellent. Now that the FDA has approved a specific test by Roche, a specific antibody test, apparently this past Friday, When can Humboldt County expect to see this offered to the local public?
So in terms of an antibody test, again, lots of these are coming out quickly. It's important for people to and providers offering them to think about their validity. We do know that these tests in general are less accurate at times where there's low prevalence in the community. In the same fashion that if we do a flu test for you in the summer, the chance that it's a false positive result is higher than when we do it in the middle of the flu season for a variety of reasons. So yes, I think these are going to become shortly available. We'll be evaluating them as they come. All of them the results are required to be reported into our state surveillance system, and that will be important for us to be able to follow the situation locally. And I hope to have our Optum site able to offer that serology as soon as it's really widely available commercially, so that we can get that information for our local area as well.
Excellent, thank you so much.
Thank you.